Welcome back to this segment of Bayou Time, as once again we listen in to the governor of the state of Louisiana talking about the Delta variant, which has numbers really skyrocketing not only in Louisiana but in the nation. Let's listen in.
Today, and the numbers that I reported to you a while ago, 2,079 of those cases are children from today's report. And we know, we told you this last week, those under 29 are driving the surge. And young people from 12 to 18 are a huge part of community transmission right now. So let's rid ourselves of the notion that children can't get COVID or that they can't have serious cases of disease. We've got doctors here who will tell you otherwise. They treat children who are struggling to breathe in our hospitals right now. The data tells us the same thing. So there are active COVID cases among children right now who are suffering respiratory problems. But we also have children in the state of Louisiana who are suffering from multi-system inflammatory syndrome as well. And we can't send children back into schools unvaccinated and unmasked. Quite frankly, we need the safest possible setting for them so that we can have as many children physically present, in person, in our schools as possible. It's important for their education, and we know this. It's important for nutrition, social and emotional wellness. And further, at the end of the day, those young people go home. And they're going home to parents and grandparents. And they're circulating in the community. So not only are they contracting the disease, and in many cases suffering from it themselves, but we know that they will be infectious as well. The indoor mask mandate will stay in place until September the 1st. By this proclamation, it may be extended if necessary. And I hope it is not necessary. We will make that determination later. And this is obviously not something that I wanted to do. But Louisiana is not in the place where we want it to be or where we need it to be. And public health and safety compel this action. I cannot in good conscience sit by while our hospitals lose the capacity to deliver life-saving care to COVID patients and non-COVID patients alike. You're going to hear from our hospital and business leaders in a moment who are not only having to deal with an increase in patients, but also an acute shortage of staff. Not counting the impact that COVID is having on staff at our hospitals that are employed. You can go to the Louisiana Workforce Commission website and you'll see that there's posting there for 6,362 nursing positions that are currently available in Louisiana. I will tell you that more than 40 hospitals in our state over the last few days have requested some staffing assistance. And the most that we will be able to deliver will be some assistance to just a handful of those. So at this point, I'm going to ask Dr. Kanter if he would to come up and to deliver his remarks.
Good afternoon. Thank you, Governor. We greatly appreciate your leadership. And to Drs. Klein, Kemmerly, O'Neill, Mason, and Ms. Sutton, thank you so much for being here. And on behalf of the Department of Health, we wanted to thank the teams and the medical staffs and nursing staffs and support staff that you represent, knowing that after a very, very long year, this is likely some of the hardest points that they're going to go through right now. So we would ask you to convey our gratitude back to your teams for what they're doing now and what they have done for Louisiana over the past year. Louisiana finds itself yet again on the leading edge of a very dangerous surge that is going across the country. And As the governor noted, we are both the #1 state in the country now for COVID-19 in terms of new cases. We are also at the highest point, or just about, we have ever been in terms of COVID-19 in Louisiana. And that's an uncomfortable thing to say out loud, and I think many would find it a shocking thing and almost be in disbelief that this far into the pandemic, this is where we would find ourselves. But I hope after today's comments, folks will have a clear understanding of the picture that we're in, what our hospitals are facing, what is at stake, and what we as a community need to do to turn it around. I'm going to go over some numbers that we share every time that we get together, just to catch people up as to where we are. This is a familiar graph. On the top left, you see COVID-like illness. That's the percentage of ER visits that are attributable to COVID-like symptoms. For example, cough, fever, shortness of breath. As of today, 13.4% of every ER visit in the state is somebody seeking care for these type of symptoms. That is the highest mark it has been at any point in time during the pandemic. On the top right, you see incidence. This is the number of new COVID-19 cases diagnosed every day, smoothed out over a 7-day average. As of today, we are averaging 88.2 new cases per day per 100,000 residents. That is the highest point it has been in Louisiana at any point prior in the pandemic.
We'll be back with a lot more. We have a segment coming up. We'll continue to listen in on the governor of the state of Louisiana.